Frotteuristic disorder represents one of the most challenging and misunderstood paraphilic disorders within the spectrum of human sexual behavior. This condition involves recurrent and intense sexual arousal from touching or rubbing against a non-consenting person, typically occurring in crowded public spaces where the perpetrator believes they can avoid detection and accountability. The disorder manifests through persistent fantasies, urges, or behaviors that involve non-consensual physical contact, creating significant distress for both the individual experiencing these compulsions and their unwitting victims. The clinical definition of Frotteuristic disorder requires that these sexual urges and behaviors persist for at least 6 months and cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. Mental health professionals recognize this condition as a serious psychiatric disorder that demands comprehensive treatment and intervention. The behavior typically involves touching or rubbing the genital area against another person's body, most commonly in situations where the victim may attribute the contact to accidental bumping or crowding, such as on public transportation, in elevators, or at concerts and festivals. Understanding the psychological underpinnings of Frotteuristic disorder requires examining the complex interplay between developmental factors, neurobiological influences, and social conditioning. Research suggests that individuals with this condition often experience their first symptoms during adolescence or early adulthood, with the behavior potentially stemming from difficulties in forming appropriate intimate relationships or managing sexual impulses through socially acceptable means. The disorder frequently co-occurs with other mental health conditions, including anxiety disorders, depression, and other paraphilic disorders, creating a complex clinical picture that requires specialized assessment and treatment approaches. The impact of Frotteuristic disorder extends far beyond the individual experiencing these compulsions. Victims of Frotteuristic behavior often report feelings of violation, anxiety, and helplessness, particularly when they become aware that the contact was intentional rather than accidental. Many victims experience lasting psychological effects, including increased vigilance in public spaces, avoidance of crowded areas, and general feelings of vulnerability. The non-consensual nature of these acts constitutes sexual assault in most legal jurisdictions, carrying serious legal consequences for perpetrators while highlighting the urgent need for effective prevention and treatment strategies. Treatment approaches for Frotteuristic disorder typically involve a multifaceted therapeutic strategy combining cognitive behavioral therapy, medication management, and intensive psychosocial support. Cognitive behavioral interventions focus on helping individuals recognize triggers for their inappropriate behavior, develop healthy coping mechanisms, and build skills for forming appropriate consensual relationships. Therapists work with patients to challenge distorted thinking patterns and develop empathy for potential victims, while also addressing underlying psychological issues that may contribute to the disorder's persistence. Pharmacological interventions may include selective serotonin reuptake inhibitors, SSRIs, or anti-androgen medications in severe cases, aimed at reducing the intensity of sexual urges and compulsive behaviors. However, medication alone is rarely sufficient to address the complex psychological and behavioral aspects of Frotteuristic disorder, making comprehensive therapeutic intervention essential for successful treatment outcomes. The treatment process often requires long-term commitment and ongoing monitoring to prevent relapse and ensure public safety. Prevention strategies for Frotteuristic disorder focus on early identification of risk factors and intervention before problematic behaviors become entrenched. Educational programs that promote healthy sexuality, consent awareness, and appropriate relationship skills can play a crucial role in preventing the development of paraphilic disorders. Mental health professionals emphasize the importance of addressing childhood trauma, social isolation, and difficulties with impulse control that may predispose individuals to developing Frotteuristic behaviors. The legal implications of Frotteuristic disorder are significant and multifaceted. Many jurisdictions have specific laws addressing non-consensual sexual contact, with penalties ranging from misdemeanor charges to felony convictions depending on the severity and frequency of the behavior. Legal consequences may include imprisonment, mandatory registration as a sex offender, and court-ordered psychological treatment. These legal ramifications underscore the serious nature of the disorder and the importance of seeking professional help before engaging in illegal behavior. Research into Frotteuristic disorder continues to evolve, with scientists investigating neurobiological factors, genetic predispositions, and environmental influences that may contribute to the development of this condition. Advanced brain imaging studies have revealed differences in neural activation patterns among individuals with paraphilic disorders, suggesting potential biological markers that could inform future treatment approaches. Additionally, researchers are exploring the effectiveness of virtual reality therapy, mindfulness-based interventions, and other innovative treatment modalities. The social stigma surrounding Frotteuristic disorder often prevents individuals from seeking appropriate help, creating a dangerous cycle where untreated symptoms may escalate over time. Mental health advocates emphasize the importance of reducing shame and stigma while maintaining clear boundaries regarding the unacceptability of non-consensual sexual behavior. Creating safe spaces for individuals to seek help before engaging in harmful behavior represents a critical component of comprehensive prevention efforts. Support systems for individuals with Frotteuristic disorder must balance compassion and understanding with firm boundaries regarding acceptable behavior. Family members, friends, and treatment providers play crucial roles in maintaining accountability while encouraging therapeutic engagement. Support groups, both for individuals with paraphilic disorders and for family members affected by these conditions, provide valuable resources for understanding, coping, and recovery. The prognosis for Frotteuristic disorder varies significantly depending on factors such as the individual's motivation for treatment, the presence of co-occurring mental health conditions, and the availability of comprehensive therapeutic resources. Early intervention and consistent treatment engagement generally lead to better outcomes, while individuals who delay seeking help or who have multiple paraphilic disorders may face more challenging recovery processes. Long-term success often requires ongoing therapeutic support and regular monitoring to maintain behavioral control and prevent relapse. Understanding Frotteuristic disorder within the broader context of human sexuality and mental health helps reduce stigmatization while maintaining appropriate boundaries regarding consent and acceptable behavior. This nuanced approach recognizes that individuals experiencing these symptoms deserve access to effective treatment while simultaneously protecting potential victims and maintaining community safety. Continued research, education, and advocacy efforts remain essential for developing more effective prevention and treatment strategies for this complex and challenging disorder.